My name is Mary Terry Fajardo. I'm a pediatric epileptologist. I work at Nicholas Children's in Miami, and I have the honor of working with lots of families who are living with epilepsy, and just very grateful to have the opportunity to be here today and speak to all of you and connect with the community. So I'll try to get us closer to schedule as well. I'll be speaking on caring for your loved one with Lennox-Gastaut syndrome, what to know about FINTEPLA, which is fenfluramine. I'm just wondering if this changes my... Does this move forward, the slide? Oh, no. Top one. There we go. Thanks, guys. All right, so what we're going to be covering, a few sort of kind of big picture items about FINTEPLA and what you might be wondering about and what to know. So treatment goals for LGS, what exactly is FINTEPLA, how FINTEPLA may help your loved one, and what are some practical tips, what to expect if being prescribed, what questions to ask your care team. So this is not new information, right? This is part of what we're often talking about. When we're thinking about treatments for LGS, we're looking for finding the right balance. It's a matter of ensuring and maintaining good quality of life, like Amy was speaking on, and the balance of that is taking care of seizures, trying to minimize the number of life-threatening and seizures that can cause injuries, such as drop seizures, and balancing side effects, so the effects that these medications can have on behavior, on cognition, et cetera. So our goal is to find what is that right balance of seizure control and minimizing side effects. So in comes FINTEPLA, which is fenfluramine. This is a prescription medication. It's been approved for treatment of seizures that are associated with LGS in patients age 2 and older. It's been proven through clinical studies and trials to significantly reduce seizures that are associated with LGS. It works a little differently than other available treatments, mechanism of action, so it represents a new mechanism of action that entered the treatment space. It works at specifically the serotonin 5-HT2 receptors. The precise way that working at these receptors actually helps with the treatment of seizures is it's not completely understood, which is common in lots of our treatment strategies, right? We study the different mechanisms and we have hypotheses, but obviously these are complex systems, and so we don't always know exactly the way, but we know it works at these receptors. And importantly, FINTEPLA can be added to someone that's, to a list of medications that someone might be taking without making significant changes or any changes to the current list of anti-seizure medications. It's not been shown to clinically significantly impact the pharmacokinetics of the other anti-seizure medications, and that's important to know and something to keep in mind. And then lastly, it's taken orally, so it comes in a cherry-flavored liquid formulation, and it could be taken with or without food, and it is also compatible with feeding tubes. So important safety information, the indication, as I've already mentioned, it's used to treat seizures that are associated with Dravet syndrome and Lennox-Gastaut syndrome in patients that are age 2 and older. It is not, it's not well known or studied whether FINTEPLA is safe and effective in children that are less than 2 years old. And there are some serious side effects to keep in mind. There has been previously an association made with problems in the valves of the heart and also in the blood pressure in the pulmonary arteries. So then we have to monitor patients on FINTEPLA with something called echocardiogram. So these are ultrasounds that we do of the heart. We usually do these before starting the medication, every 6 months while on the medication, and then once more after the medication is stopped. So the data that we have that supports its efficacy, so there's a meaningful reduction in seizures that lead to drops or falls. The initial clinical study was a 14-week trial, and adding FINTEPLA, it was a double-blind placebo-controlled, so it was compared to placebo, and adding FINTEPLA led to a reduction of, in patients taking FINTEPLA, 24% of them had a 24% reduction of drop seizures in a month. So in these trials, as we were talking about, like the way that some of these trials work, they're looking at your baseline seizure frequency, and they really try to separate out which ones are the ones that are leading to drops, which are often associated with injury, right? And so compared to baseline, patients that were on FINTEPLA had a 24% reduction in those drop seizures compared to 9% in the placebo group. That's a 2.7 times greater reduction with FINTEPLA compared to placebo. Beyond that, importantly, they also found that there was a 46% reduction in the generalized tonic-clonic seizure type as well, which I think is really important. Beyond that 14-week trial, they also had the option of enrolling in a long-term open-label study. I think it's really meaningful to hear that from the original clinical study, 94% of the patients chose to continue on to the open label and stay on FINTEPLA. That means only 6% of those patients stopped the medication. In the open label study, we showed that there were 50% of patients that experienced 7 or more drop seizure-free days in a row. And that is, I think, something that's important to note. And then within this population as well, 25%, so a smaller group, but a meaningful group, a quarter of them, experienced 17 or more days of drop seizure-free days in a row. And I think that that can be really impactful when we're thinking about quality of life, just having 17 days in a row of no drop seizures. We also have some information regarding how the FINTEPLA may or may not interact with a patient's behavior and cognition. So in the clinical trials, they had patients or families and caregivers fill out rating scales, one called Behavior Rating Inventory of Executive Functioning, also known as BRIEF. This looks at behavior, emotion, and cognition. So how are families and how are patients doing with stopping trouble behaviors when they're called to their attention, acknowledging that the behavior affects other people, how are they regulating their emotional reactions, how are they adapting to new situations, and how are they working with getting started on task and holding information in active memory. So like understanding what they're trying to get done and keeping that information of like what task they're doing, what is relevant to be able to participate in more activities. There was no worsening of behavior, emotion, and cognition that was observed in patients that were being treated with FINTEPLA compared to placebo. Beyond that, we have some of the ratings of improvement that were filled out by the caregivers. 85% rated that their loved one had improved or no change compared to the prior visit of these, specifically these subdomains of behavior, cognition, motor abilities. But I'd like to sort of draw the attention also to the graph over here onto the right, where you see the different categories of very much improved, minimally improved, or no change. Because I think it's important that the majority, like 50% or slightly above 50%, actually saw improvement. And so that's also something worth noting, that there was an overall impression of improvement in overall cognition and behavior with FINTEPLA. Common side effects that we might see with FINTEPLA. So the most common side effects include diarrhea, tiredness or fatigue, vomiting, sleepiness, and decreased appetite. And I always like to mention that a list of side effects that can be possible with a medication does not necessarily imply that the patient is going to experience all of these. And it's just something to be kind of aware about, that this is something that's been reported, right? Approximately half of patients that did have any concern about weight or decreased appetite actually resumed expected weight gains during the open label extension, so it was not something that impacted significantly their overall nutrition status. And like I mentioned earlier, 94% of patients in the original 14-week placebo-controlled trial continued on to stay on the open label, so we have 6% of patients had discontinued due to side effect. And then I already mentioned, I think, that these are not all the possible side effects. As we know, lots of, when we read medication information, there's lots of possible or reported side effects. And so if you have more questions about that, or if you notice something differently, then I obviously encourage you to discuss it with your healthcare provider. So because of the prior associated incidences that has been noted with the concern for valvular disease and pulmonary arterial hypertension, FINTEPLA is specifically monitored and available only through what we call a REMS program. So this is FDA regulated, and what it means is just that there's going to be actually even more care and attention for the process of getting FINTEPLA. So it's delivered by a specialty pharmacy. It is monitored heavily, so you need to have your echocardiograms or the heart ultrasounds done regularly. And if a patient does not get those studies done and we cannot safely monitor them, then we cannot safely dispense the medication. One thing that is, I think, very helpful is that through FINTEPLA, there is a program called Onward. And you can think of it as a comprehensive patient support program that really helps to ensure that the echocardiograms are accessible and easy to get done, and that the enrollment forms and the medication, the specialty pharmacy and everything is able to be delivered. There's also a program because sometimes it might be difficult to get to a specialty center that offers echocardiograms or get families in to be seen. The Onward program actually helps to connect families to get at-home echo. So there's a mobile echo service that comes to the patient, and I think that really helps to make sure that we're able to safely monitor, but it's also something that's not so burdensome and maintains access to the medication. And then lastly, since the approval of FINTEPLA back in June 2020, which is kind of crazy how time is flying by, there's been more than 15,000 patients worldwide that have been prescribed FINTEPLA. So if you're thinking about or have questions about FINTEPLA and whether it might be an appropriate medication for your loved one, some questions you can bring to your doctor would be, do you think that this is appropriate for us? How would we measure success? We don't take lightly the adding on of medications, and several people have talked about, the burden of being on multiple medications. And so, I think it's an important part of the conversation, okay, so what is our goal with this treatment? And, should we start ahead of time counting drop seizures a month just to get a good sense of what we're seeing and being able to measure that improvement? What side effects should I watch out for? And how often is monitoring needed? Like I mentioned, the echocardiograms we do every 6 months, of course. So we have this QR code here, but it can give you access, if you can scan it, it can give you access to caregiver stories and videos, educational videos, more details on the clinical trials with FINTEPLA, what have been the results, more information about the safety and the REMS program, how to get started, and the support options that I've previously mentioned. I think that might be my last slide, so hopefully I didn't take too much time. And again, thank you so much for the opportunity to be here and connect with you guys.